And today's topic is Norma Basalis. Here you could see this is the inferior view of the skull, which is the Norma Basalis. It includes the inferior view of the viscerocranium and the neurocranium. Neurocranium in its inferior view to its the fullest, and the viscerocranium is minus the mandible. Mandible is removed from the facial skeleton of the viscerocranium. That inferior view and the inferior view of the this skull. This is the cranium, right? Neurocranium. So this is the inferior view of the neurocranium and the viscerocranium minus the mandible. So boundaries, as you see, this is anteriorly are the incisor teeth. Here the incisor teeth. These are interiorly. This is the anterior boundary of the Norma Basalis, and posteriorly is the superior knuckle lines. You see the pointer. Yes, these are posterior knuckle lines, right? And on the lateral sides, this is the alveolar arch. This is the alveolar arch. This is containing the teeth sockets. This is the alveolar arch. Then is the lower border of this zygomatic bone. This is the zygomatic bone. Then is the lower border of the zygomatic arch. This is the zygomatic arch. It's already studied in norma lateralis. And the mastoid process. This is the mastoid process. See the pointer? It's labeled over here. This is the mastoid process. And this, again, this superior knuckle lines. So this is the boundaries, and most of the anatomists divide the Norma Basalis into three parts, with anterior, middle, and posterior by two imaginary lines. How they are drawing? They are drawn in red in this picture. This first anterior line is at this. This is hard palate, and this is its posterior aspect of the hard palate, and a line drawn horizontally from that. This is one line, and another line drawn from this point. This is foramen magnum. Foramen magnum. It's interior part, and it's a second line divide horizontally from that. The part anterior to this line anteriorly, which is this hard palate or posterior aspect of hard palate. See the pointer. First line. This is anterior part. The part between two lines is middle part, and the part posterior to this line, second line, is this posterior part. So let's do that. So this is the Norma Basalis bones, which are the various bones into that are the maxilla, palatine, sphenoid, vomer, temporal, and occipital bones. You identify in this picture these bones, right? It's written in these colors. Even this frontal is included in this picture. This minor aspect, you see the pointer, you see this green, this here, it's a frontal. So then is this maxilla, large contribution anteriorly from this maxilla. You see the pointer. This is the maxilla. You see this mauvish or purplish sort of color. This is maxilla. Then is the occipital bone. The largest contribution in this Norma Basalis is from occipital bone. This is the occipital bone. This sort of, you can say, this pinkish color or whatsoever. You can identify from here this table of the colors, bones, and this is the large contribution. Which various parts of the occipital bone will describe later. So this is the bones. You can first, yes, this is here. This is the occipital. Then is the palatine bone. This is the, you see, the anterior part. This was the anterior, was the line drawn arbitrarily. So this is the your bone, the palatine. So this is the palatine bone, posterior to this your maxilla, right? This is the palatine bone in this color, reddish color. And then is you already familiar with this parietal bone laterally, and then is the sphenoid, a large contribution coming from this sphenoid. Various portion we'll discuss soon. This is the sphenoid, the pointer moving around this sphenoid, right? And in between sphenoid is a wedged bone, which is in green shown here. This is vomer. You see the pointer? This is the vomer. Pointer moving around that is the vomer. And on the lateral sides, the parts of the sphenoid bone. So the very also a big contribution from this temporal bone. This is various parts. This is one part, uterus part, and then this is the other part, squamous part. This is of the temporal bones. And then is the your vomer. I already told you. Then this blue is the zygomatic bone, right? This is all bones have told you visible from this inferior view of the Norma Basalis. We have to discuss in subsequent sections various parts of the bones, names, independent parts, names, and the foramina. It's very important aspect of this Norma Basalis is various foramina and the structures passing through these foramina, like this is foramen magnum is the most salient feature of this Norma Basalis is the foramen magnum, and very important structures pass through that. And we often get a question in exam, what name the structures passing through foramen magnum. I have a separate slide for that. So very important thing is hard palate. So what is that? Hard palate. This is this anteriorly. This is the hard palate, which is formed by two bones, maxilla and the palatine bone. And this portion, move to a larger picture in the color. Yes, this is the maxilla, right? And this is the your palatine bone, right? These two bones contribute to the formation of the hard palate. You see the pointer? This is the hard palate. These two bones contributing to that, and this is the palatine process labeling. You see the labeling? Palatine process of the maxilla. This is maxilla in this color, mauve color. This is the palatine process of the maxilla, anteriorly contributing the most part of the hard palate. This is the palatine process of maxilla. And as we move posteriorly, this is the horizontal plate of the palatine bone. This color is reddish. This is the horizontal plate of the palatine bone. These two bones form the your hard palate, and in the midline projecting from the posterior border of the hard palate is the posterior nasal spine. This is the posterior nasal spine, and also present in these parts of the greater and lesser palatine foramina in this palatine bone, and this is the greater and lesser palatine foramina. And anteriorly below the incisive, behind the incisors teeth is the incisive fossa. This is incisive fossa, and also present here is a incisive canals. So this is the hard palate. So this is, you can see over here, and then is I've told you already, greater and lesser palatine foramina. Let's study a few words for the Vomers, right? So again move to this diagram. This is green color. You see the pointer? This pointer is on that side, right? This in the, you see in the middle of the picture, in the green color, vomer. This is wedged between the various parts of the sphenoid bone. So this is vomer. So it's wedge shaped. It's the word is plowshare. This is also unpaired bone, single bone. It's a trapezoid shape. Now let's study various parts of the sphenoid. Very important contribution coming from the sphenoid bone. See the pointer? The parts here, you see its attachments to the bones, other bones. Anteriorly, it's attached with frontal bone, posteriorly with this temporal bone. You see this sphenoid, this is the temporal bone, and also this occipital bone. These are the three bones. And you remember sphenoid is also known as pterygoid. Sphenoid is also known as pterygoid bone. So its various parts, this is a body and the three pairs of processes, greater wings, lesser wings, and pterygoid processes. Move to a larger picture. Yes, we see over here. You can see this is the sphenoid, the pointer you can see, and this is the pterygoid process with medial and lateral pterygoid plates, medial and lateral plates of pterygoid processes. Here you could see this is the pterygoid process. These are the medial and lateral plates. This is the greater wing. You see the both sides. This is the greater wing. This is the greater wing. This is greater wing, and this is in the center is the body of the sphenoid. Body of the sphenoid, and laterally are the medial and lateral plates, which together form the pterygoid process on each side. This is the parts of the sphenoid. So, greater wings have orbital, temporal, and infratemporal surfaces. Here you see some important structures, like this is the groove for cartilaginous part of the pharyngotympanic or auditory tube. So this is over here. If you could see, this is the pointer here. This is the groove. This, right? You see this pointer. So you see this is medial to the spine of the sphenoid. This is spine of the sphenoid, and inferior to the junction of the greater wing of the sphenoid and the petrous part of the temporal bone. This is the petrous part of the temporal bone. This is rock-like, very hard. This is the petrous part of the temporal bone, right? This again. To identify again, move to even a larger full-size picture. Here you could see. Yes, here it is. This is groove for the cartilaginous part of the pharyngotympanic tube. Here this is the labeling. This is anterior to this groove is anterior to this petrous part of the temporal bone. This is petrous part, and this anterior to that is this is the greater wing of the sphenoid. This is greater wing of the sphenoid, petrous part of the temporal bone, and this is spine of the sphenoid. So it is medial to the spine of sphenoid, and anterior to this petrous part of the temporal bone, and this groove is posterior to the greater wing of the sphenoid, as you can see the point. So this then another important point on the temporal bone. This is some squamous part is visible in this Norma Basalis too. So it contains a mandibular fossa, which accommodates the mandibular condyles when the mouth is closed. Mandibular condyles and mandibular fossa. The joint formed is temporomandibular joint. So you identify this is mandibular fossa. This is the pointer, and this fossa is the mandibular fossa. This also see here in this is the mandibular fossa. This bluish covered with hyaline cartilage. This is the mandibular fossa. Then a few words about the occipital bone. It has various parts, this occipital bone, and of course it contains a foramen magnum, and this is the most conspicuous feature of the cranial base, foramen magnum. So let's see the parts of the occipital bone. Here you could see this the largest contribution of the cranial base formed by occipital bone. This part is the squamous part. This part is the squamous part of the occipital bone. This is the basilar part. Basilar part, basi-occipit of the this bone, your occipital bone. Basilar part, squamous part, and on the here are the lateral parts, which is the four parts: lateral parts, basilar part, and this the squamous part. In between these is the foramen magnum. You see here even these are your occipital condyles. These are overlapping this foramen magnum, occipital condyles. Foramen magnum is oval shaped, which is larger posteriorly and narrows anteriorly. These are the occipital condyles, and various foramina over here, right? We see this jugular foramen. You see this jugular foramen present between this squamous part of the this lateral part of the your occipital bone and this petus temporal. This is the jugular foramen. This is the thing. And then one foramen is the stylomastoid foramen posterior to this styloid process. This is the styloid process of the temporal bone, styloid process. And posterior to that is the stylomastoid foramen. Styloid process anteriorly and the mastoid bone posteriorly, mastoid process. Mastoid posteriorly, styloid anteriorly. It forms the word stylomastoid, and this is a foramen, stylomastoid foramen. So the structures passing through I have enlisted in a table, and we will study from that table subsequently very soon. So this is a foramen over here, and which is visible in the base, and over here this is where you see, and this is jugular foramen, and anterior to that is the carotid canal. As you could see, this is the pointer, this is the labeling, and this is the carotid canal for the passage of the internal carotid artery. So right, this is various structures over here, and also various foramina in the sphenoid bone studied over here. Right, this is the foramen ovale. This is for the passage of the mandibular nerve. This is the foramen ovale. This is in the sphenoid, greater wing of the sphenoid contains the foramen ovale, and also is present as a foramen spinosum in the this is a spine of the sphenoid, and it also contains a foramen spinosum. This is first you see foramen ovale over here, right, and this is the labeling of the foramen spinosum in the this angle of the sphenoid. This contains a foramen spinosum. This is foramen spinosum, and this is the foramen ovale, important foramen over here. This you see, and so you see various portions of the bones over here, visible over here, various foramina. And I was focusing on the occipital bone and foramen magnum with studies, and then this is the figure which tells all the structures in detail which pass through the foramen magnum. And you can study from here. This is the apical ligament. You see anteriorly I am starting this green 3 ligaments. Apical ligament, upper vertical band of cruciate ligament, and then this is the membrana tectoria, or the tectorial membrane. We will study later these structures. You just name them. You become familiar with the names, and you have to memorize at this stage which structures passing through foramen magnum. It's a question in the university. Anterior spinal artery is also passing. This is the arachnoid matter labeled, and you see this is part of the meninges. So you can write meninges. So this is the vertebral artery, fourth part with sympathetic plexus. First tooth of ligamentum denticulatum. This is the ligamentum denticulatum. Spinal root of accessory nerve, and this is a very important structure. Rather, you can say the most important structure passing through the foramen magnum is this. This is the lowest part of medulla oblongata. Lowest part of the medulla oblongata, which downwards continues as your spinal cord, and also is the posterior spinal artery. This is pia, dura, and collectively to dura mater, pia mater, and arachnoid mater, you can say meninges passing through that. So this is the thing. I showed you the occipital condyles. Through these condyles, it is this cranium base is attached to your vertebral column, C1 vertebra. So I also told you about this jugular foramen. I told you where it is present, and this is the jugular foramen. This is the mastoid process where muscles are attached. I will show you. This is the mastoid process. You're already familiar with that. Norma literalis. this stylomastoid foramen. As I also showed you that stylomastoid foramen, where it transmits facial nerve and stylomastoid artery. So coming to the attachments of the Norma Basalis, you could see this. This is your knuckle line superior. This is medially the trapezius is attached, and this is as we go laterally, we get the occipitofrontalis, occipital belly to that line, even to the highest knuckle line. If the highest knuckle line is not present, this is attached to the superior knuckle line. This is splenius capitis, and this is the various muscles over this aspect present. This is semispinalis capitis. This is obliquus superior. This is rectus capitis posterior, and this is the rectus capitis posterior minor. This was major, this was minor, right? This is rectus capitis lateralis. This is longus capitis. This is rectus capitis inferior. See the pointer. This is the pharyngeal tubercle. This is the hypoglossal canal, and also visible on this Norma Basalis. This is hypoglossal canal. This is the inferior knuckle lines. So superior knuckle lines, inferior knuckle lines. So these are the attachments in detail, the various attachments. Like this also contains this attachment of the occipital belly of the occipitofrontalis, the trapezius. You can study later on your own. I'll discuss with you these important structures. If you want a very detailed attachment, it's all labeling. Well, I will send you this attachment picture in separate. You could enlarge in picture gallery and study in detail what's the various structures attached to that, and we'll study the various labelings like in the flashcard or the assignment I will give you would be the also containing detailed flashcard. This is the summary of the major structures passing through foramina, the important foramina. Like this is carotid canal that you can study on its own, and I've already told you that through the foraminoveal passes it is present in the greater wing of the sphenoid, and the mandibular nerve passes through that, and foramen spinosum passes the meningeal vessels, which this is all the foramina. We have to see which is the foramina present in the basilar part of the occipit, inferior view, Norma Basalis. So these are the this is the jugular foramen. Again, it is internal jugular vein, vagus, glossopharyngeal, and accessory nerve. Very important. Through the jugular foramen, 3 cranial nerve passes: internal jugular veins, vagus, glossopharyngeal, and accessory nerves. And also is the foramen lacerum, which passes through that internal carotid artery. So this is the various structures, various important foramina. This is hypoglossal foramina, also showed you, contains passes a hypoglossal nerve. This is the carotid canal I showed you. This passes the internal carotid artery. And greater palatine foramina, the greater palatine nerve and blood vessels. Let me show you again this, I think, foramen lacerum. Yes, you could see here. This is the foramen lacerum. Yes, this foramen lacerum present between this petrous part of the temporal. See the pointer. This is the petrous part of the temporal bone, and this is the sphenoid bone, and this is the basio-occipit, and here is present is your foramen lacerum. So that was a few words about this Norma Basalis, its most features, bones contributing to that, foramina, structures passing through that, and muscles attached, and various. This is your assignment for today. Very simple diagram. What are the structures? This is scalum, and you can label all this. You have to label and send it to me. So this is a where foramen labeled to all. This labeling is very important. You see, I will give you the key afterwards, and this is a inferior view, the Norma Basalis, and this is a flashcard. You have to identify the indicated structures in the inferior view of the skull. This is the Norma Basalis completed. Thank you very much.